it. Check others, especially scan down range to see if anyone else is hurt. If the hurt's a gunshot wound, please understand there's nothing you can do to make that injury any better on scene. But there's a lot you can do on scene to hopefully slow the damage, to buy time until the next level of care is reached. If you carry a gun, having the equipment, skill, and training to deal with a gunshot wound is a sensible precaution. Disclaimer: nothing in this video should be considered medical advice. I'm telling you what I do, not what you should do. This section is not a substitute for professional in-person training. You should seek competent medical training and never use any medical equipment outside your area of competence. With that out of the way, let's see common equipment for gunshot wound. The equipment needed is not overly expensive or bulky. I carry mine in an ankle kit, but you can easily slip it into a purse, pocket, or a backpack. Basics are tourniquet, wound packing material, chest seals, glove, and trauma scissors. Tourniquets for uncontrolled extremity bleeding, wound packing material for areas between limbs and torso, chest seals for torso penetration, gloves so you don't share blood pathogens, and trauma shears to clear gear and clothing away to treat. The actual how is beyond the scope of this course, but be on the lookout in the months ahead as we are planning on doing a training section focused on just gunshot wounds.